That's fine.
Welcome, 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 and good morning from National Health Careers Conference 2021. I'm so sorry for the delay, about 20 minutes. We had some technical issues, but hopefully they've been sorted for the rest of the day. My name's Jono, and I'm a doctor based in South London, but presenting to you live here from Manchester. Our aim is to inspire health and career heroes, which we're sure you will be one day. This event is held by Health Careers Live, an award-winning, not-for-profit organisation led by volunteer healthcare professionals, students, professionals, and patients and advisors. So take control of your future today. Just a couple of things on how you can maximise your day. Be sure to add talks to your calendar that you're interested in. Make notes during some of the talks and check out the Reflections portfolio. Use exhibition time to visit exhibitors and discover valuable resources. But also be sure to take regular breaks away from your screen so that you can keep well hydrated. But most importantly, enjoy your time. Be sure to spread the word on your networks using the hashtag #HealthCareersLive. So in a moment, I'm going to pass you over to Sunny, who will explain the platform to you in a bit more detail.
Hey, welcome to National Health Careers Conference 2021. It's a pleasure to see you all today. Nice and bright, nice and early on this Saturday morning. And I know there's one big game on. It's United and City around where we are today. It's going to be an amazing day. It's going to be lots of learning, lots of fun, lots of interactivity. The hashtag is #HealthCareersLive, and you can use @HealthCareersCode to tweet us throughout the whole day. And as John was saying, there's going to be lots of reflections. And coming up later on, at the end of the day, is the reflections disco. So do make sure you stay till the end and enjoy all the learning. A quick tip on the platform: we're using two ways to broadcast today. We're using Hopin, which is our virtual platform from Virtual Studio Live, and you will be able to see the stream on YouTube, and also you'll be able to see it on Facebook and our Twitter accounts. So if Hopin is not working for you, then don't worry. You can always go onto YouTube. You can go onto Twitter, and you'll be able to see the live stream there of the main stage. And I'll be back in a bit after the first talk to explain a bit more about what else we have for you, including the amazing exhibitors and healthcare convos from Olympus. Thank you.
So our first talk is NHS Health Careers. That's just doctors and nurses, right? But today I'm joined with Abigail Changer, Careers Information and Quality Lead with Health Careers UK, Health Education England. Hi Abigail, how are you doing?
Morning, Jono. I'm very well, thank you.
Good. I'm so sorry for the delay this morning. Hopefully you're still as enthusiastic as you were a bit earlier.
Yep, standing by, raring to go.
Perfect. I'll hand over to you.
Lovely, thank you. Okay, good morning, everybody, and yeah, thank you so much for joining this talk today. I know we're running late. I'm going to try and see if I can catch up a little bit of time. Got quite a bit of information to get through, but hopefully this is a great start to the day in that I'll be able to give you an overview of some of the careers in health and some of the routes in as well. And you know, some of you might be joining with a really good idea of what you want to do. Some of you might be joining thinking, I want to do something in health, something in the NHS, I'm not quite sure what. So hopefully what I'm about to tell you will open your eyes a bit and also give you some further resources so that you can go away and have a look. So yeah, as Jono says, my name is Abby. I'm from the NHS Health Careers team, yeah, going to be with you for a bit, go through some slides and then hopefully have some time for Q&A. So please do get your questions in. Okay, so one of the there are over 350 different careers in the NHS, and we're obviously not going to be able to talk through all of those today, but the important thing that binds all of those roles together is the fact that each and every one of those roles makes a difference to patients' lives at the end of the day. So whether you are doing a role that's very hands-on, patient caring, that direct patient contact, or you're in more of a behind the scenes role, maybe in an office or a laboratory, it doesn't matter because each of those roles is working together to improve the lives of patients at the end of the day. So there's a real satisfaction in knowing that. Okay, so what I'm going to do, I'm going to talk a little bit about background and context, talk about some of the careers that are available. As I said, we won't have time to do them all. Talk about how you can start, and then talk about a little bit about some of the financial support that's available, where you can find out more, and then also talk briefly about the NHS Jobs website, which is a really, really helpful resource. Okay, so one of the first things to tell you is actually that NHS healthcare is delivered by loads of different organisations. There are, you know, close on 1,000 different organisations, and they are each classed as an employer in their own right. And the reason I tell you that is because each one of those employing organisations might have slightly different apprenticeship opportunities available. They might call similar roles slightly different titles. They'll have different kind of work experience arrangements, different volunteering arrangements. So it's just something for you to be aware of. Okay, so the NHS, as you probably know, is massive, biggest employer in Europe and approximately the 5th biggest employer in the world. And there is that real feeling of belonging to a great big extended family. I've been in the NHS for over 25 years now, started off as a nurse and have moved into non-clinical roles. And I do have that sense of pride of working for the NHS and that feeling of belonging to something that does amazing things. Okay, so in terms of the different careers, we attempt to group them. It's never perfect when you try and categorise things, but these are the groupings that we've got that we use within NHS Health Careers. So I'm not going to talk through each of these groupings now because it would take too long, but hopefully you can see just from a quick glance the amazing range, whether you're talking about allied health professionals, which I know you'll be hearing a lot more about today, so I'm not going to spend a lot of time on those, but some really exciting, innovative roles that make a real difference to patients' lives, and right through to pharmacy, to the psychological professions, which is really growing in number, both in terms of number of staff and types of roles, nursing with the 4 specialties, the medical associate profession, so that's a role like physician associate, healthcare science. You know, healthcare science has really had its time in the spotlight during the pandemic, and I think we've all become much more aware of what healthcare scientists do. Health informatics as well, a really growing area. You know, we know that we need people who can understand data and analyse it and report on it, present it in a way that makes it understandable to other people. And that as well, in the end, improves quality of patient care. Public health as well, you know, again, has come to the forefront during the pandemic. So if you've got that love of science, that interest in human behaviour, you want to make a difference on a kind of society level, health prevention, health promotion, then something in public health might be for you. And all the other ones, as I say, we haven't got time to go through them all, but that incredible range, whatever your skills and your interests. So as well as the massive range of roles, we've also got a range of routes in. So whatever stage you're at, whether you are a school leaver, whether you've been to FE college, whether you're coming up to getting out of university, whether you've worked somewhere else in another sector, whatever stage of life you're at and whatever your academic level, there will be a route in for you. And that's a really important message, because I think sometimes people think, well, I haven't got a degree, or I'm not going to be able to get a degree, I won't be able to join the NHS. That's just not true, because there are routes in, there are apprenticeship routes in, there are entry level roles. With some of the apprenticeship routes and entry level roles, you might even be supported to gain your maths and English GCSE by the employer. So even if you haven't quite got your maths and English GCSEs, there still could be a way in for you. Some of our roles you do require a degree for, and some of them you require postgraduate training for, but there is an absolute, it spans the whole academic levels, and there really is something for everybody. Okay, I just wanted to talk, I mentioned apprenticeships briefly already. I just want to highlight some of the few vacancies that we've seen over the last few months. Again, just to give you a taste of the range. So you can see everything from carpenter and joiner there to dental nurse apprentice, workforce intelligence, so people who are working, as I said, with data and numbers. And then the more clinical ones, registered mental health nurse degree, so that's a degree level apprenticeship. Diagnostic radiographer, another degree level apprenticeship. So keep your eye, if you're looking for an apprenticeship, the place to look is the NHS jobs website, jobs.nhs.uk, and also the government find an apprenticeship website. They should be advertised on both platforms, but we always advise checking both of them just in case any slip through the net. So real range. And again, just to give you an idea of the degree level apprenticeship standards that have been approved for delivery. So all of these have been approved, but just a word of warning in that this doesn't necessarily mean we're seeing lots of vacancies yet, but we do hope that more will come. Okay, just a couple of example pathways if you are particularly interested in the apprenticeship route, which, as you probably know, is where you are earning a salary while you're gaining hands-on experience. So it's a mixture of classroom-based learning and hands-on experience. So the top one there, healthcare science practitioner. So this is a degree level qualification. So you could start off as a healthcare science assistant, then move on to the healthcare science associate level 4 apprenticeship, and then into the degree level apprenticeship. And with the therapeutic radiographer there, as I say, you'll probably hear much more about this from the AHP stand later, but you've got healthcare support worker level 2, which could then move you on to the assistant practitioner level 5, and then on to therapeutic radiographer at level 6, which is degree level. Okay, now I'm not going to talk through all of these because I'm very aware that we're up against it in terms of time, but nursing in the past perhaps has been quite rigid in terms of the routes into it, but now the options available are growing all the time. So again, whatever point you're at, there could be a route into nursing for you, and all of these different routes lead to the same endpoint, which is as a registered nurse with the Nursing and Midwifery Council, which is what you need to be in order to practice as a nurse in the UK. So you can see a variety of routes here from people who have got their they've got their GCSEs and then can move on to what's called the Nursing Associate Apprenticeship at level 5. That's a 2-year apprenticeship programme. And then with most employers, what that can lead on to is a shortened 2-year top-up apprenticeship to enable you to become a registered nurse. There are also routes from doing a first degree in something else. So, for example, Kamara, first degree in psychology, but then goes on to do a degree in nursing and is able to do a shortened graduate route because of that first degree. Okay, just some more examples here. So I'll just pick out the Rob, 25, with GCSE Maths and English, but hadn't got any A-levels or other level 3 qualifications, so doesn't access to higher education course in nursing, and that gives him the level 3 qualification he needs to again go and do a degree level nursing qualification. So lots and lots of different ways to get to exactly the same endpoint with the same level qualification. So, take heart if you're thinking, I'm not quite sure I'm going to be able to, to do that to do A-levels and then go to university. There are other ways of doing it that might suit your style of learning better. Okay, so just a few examples. If you're thinking, right, I'm a really practical person, I want to use my hands in a skillful way in my job. So just a small selection here. This isn't an exhaustive list, but just gives you a bit of food for thought if you're looking for that inspiration as to what might suit you. So everything from clinical scientist and respiratory and sleep scientists, clinical photographer, motor vehicle technician, drama therapist, and many, many others. Or perhaps you really want to work with children in your role. So it's not just becoming a children's nurse that's an option there. You could look into being a drama therapist, a mental health nurse specialising working with children, a dietitian who specialises in working with children. So again, lots of different options. Or perhaps, and I'm sure this goes for many of you here today, you're really into science and you want to use science in a way that makes a difference to people's lives. So you've got pathologist here, so that's a doctor who's specialised in pathology, physiotherapist, dental hygienist, radiologist. Again, not an exhaustive list, but just to give you a few ideas. Okay, so money. We all know this is important. We all know what it's going to cost us to be able to do certain training, etc. So obviously, if you're doing an apprenticeship, you're earning a wage while you're doing your apprenticeship. So that's the financial support that you get while you're doing an apprenticeship. There are quite often training positions as well in the NHS. So for example, in a lot of the psychological professions, they are paid training posts. But if you want to go off to university and you want to study, whether that be nursing, midwifery, or many of the allied health professions, there is something called the NHS Learning Support Fund. And what this gives you is £5,000 a year as a training grant. So that goes towards your living costs. It's not a loan, so it doesn't have to be repaid. That's the important thing to remember. That's the good news. So if you're studying one of those subjects in England, that £5,000 a year is paid in termly instalments. If you're studying one of the courses that's harder to recruit to, you'll get an extra £1,000 a year. So that's mental health and learning disability nursing, and also radiography, podiatry, prosthetics and orthotics and orthoptics. So they will attract an extra £1,000 a year. And if you've got children, there's some parental support. And also, because you'll be doing clinical placements for these courses, you may need to travel, you may need to stay overnight. And so there's some support towards that as well. Now, to get that fund, you apply through the NHS Business Services Authority. They administer that. Okay, values-based recruitment. This is so important, and this is bound to come up time and time again during the different sessions today, so it won't be the last time that you hear about this. If you want to work in the NHS, no matter what your role is, no matter how you're going to get there, what route you're going to take, you will need to evidence that you hold the values that align with the NHS. So these values are from the NHS Constitution, and you may well be asked about them at interview. So prepare yourself for questions about these. You might be asked to give an example of when you've demonstrated these values. You might be asked to talk about how you would expect to see these values demonstrated in the role that you're applying for. So if you're writing, supporting statement, personal statement, then make sure you include something about the NHS values, because employers are really keen to find out that not only you've got the right qualifications and experience, but that you hold these values. So that's really, really important. Okay, so work experience. This is another tricky one sometimes, and it's been particularly difficult during COVID. Think broadly. Your experience doesn't have to come from a hospital. It could come from a care home, from volunteering, from charity work. So be really broad in your thinking. Look online as well, because there are increasing number of kind of online work insight opportunities that give you that deeper understanding of what a role really involves and entails. So think as broadly as you can, and don't panic, because employers and course providers are aware of how difficult it's been to get work experience during the pandemic. So try not to panic too much about that. Okay, just quickly then to show you some resources, because I'm very aware that time is short. So the Health Careers website, this is the NHS Health Careers website, has a lot of resources on it. So that's healthcareers.nhs.uk. Head over there, there is tons of information. You can use the Explore Roles section. Underneath that, you'll find a page of information on many of the different roles in health. But we've also got some other tools on there. So if, as I said at the start, you're sitting there thinking, I want to do something in health, but I don't quite know what, then have a go at this Find Your Career tool. Series of statements, and then depending on how you respond to those statements, you then will be shown some roles that fit your skills and interests. So that might be a really helpful tool for you to have a look at. If you want to find a course that leads to professional registration, as for example, a doctor, dentist, nurse, midwife, allied health professional, then you can use our course finder tool, because we list those courses that lead to professional registration that will mean you'll be registered with the appropriate regulatory body, and that's really important. So you can search by career, you can search by region, you can search by undergraduate and postgraduate courses, and then you can click through on the view course button. That'll take you to the university website, and that's where you'll check out the entry requirements for that particular course, because as you may know already, each university might have slightly different entry requirements, so really important to check on their websites for that. The Step Into the NHS website as well, we've got, that's aimed at key stages 3 and 4. Again, there's a little career mapper tool on there and some information about some of the roles. So for some of you, if you're slightly younger joining us today, then that might be an interesting website for you to have a look at as well. And then the NHS jobs website. This is where you'll find vacancies, whether that be, you know, the standard kind of jobs or apprenticeships. So it's really good idea to register with the NHS Jobs website, because then you can save your searches and set up email alerts so that you receive email alerts when a job matching your search criteria is advertised. So a really, really helpful website. It's also where you'll find, when you find a vacancy you're interested in, look at the person specification, because that's where you'll see what the employer is looking for in terms of those qualifications and experience. So that's a really important document. You'll also find a named contact with each vacancy. Get in touch with them if you want to find out more about a job or an apprenticeship. Ask them questions. It shows initiative as well. It's a really great start in building that relationship with a potential employer. Okay, and then if you want to get in touch with your local NHS organisation, maybe you want to find out, you know, have they got any nursing, registered nurse degree apprenticeships coming up, or you've got other questions. You can use this directory on the NHS Jobs website. It's under Browse Jobs, really helpful way of finding your local NHS employer. Okay, so if you want to find out more, I hope we've got some questions coming in, but we've got just the links there to the Step Into the NHS website and the Health Careers website. And we also have an NHS Health Careers contact centre. So the details are on the screen there. You can email them at advice@healthcareers.nhs.uk, or you can call them, or you can use the contact us form on the Health Careers website. So if you think of a question after today that you really wish you'd asked, we do have that NHS Health Careers contact centre available. So I'm going to stop talking now. I realise that's been an absolute rattle through, but we do need to try and kind of, yeah, keep to time a little bit. So hopefully we've got some questions. Now I am struggling to see them actually on the screen. It's a little bit blurry. I don't know if anyone is able to read. Is anyone able to read out any of the questions to me? Is that going to be possible? Okay, that's a really good question. So it depends on the employer, because some of them, yes, you can do some apprenticeships from 16, but sometimes when there's patient contact, some employers want you to be a little bit older. So really good idea to get in touch with your local NHS organisations and find out what they've got on offer. Some NHS organisations offer kind of cadet schemes that you can access from 16. So yeah, it comes back to that kind of difference between different employers. So get in touch with your local employer, try and talk to the apprenticeship lead if you can, or the training and education department. So yeah, it could be a possibility, but it's not necessarily the case in every single NHS trust.
Hi Abigail, thank you so much for giving us that discussion about all the many careers in the NHS. To be honest, I've been working in here for about 7 years now, and I had no clue about a lot of them. So I was quite shocked.
Yeah, no, it's eye-opening, isn't it? I think people do just see, you know, often the roles that are presented to us in the media, and actually, you know, there's so much more going on behind the scenes.
It's so true. Well, thank you very much for being here today. Would you be okay to stay on just to answer any questions that might pop up in the chat?
Yeah, of course, that's fine.
Thank you. So in a moment, I'm going to pass on to our next speaker, who will be Dr. Kieran Walsh, the Clinical Director at the British Medical Journal, with three of his colleagues, Dr. Amil Mair, Dr. Angelica Sharma, and Dr. L.B. Brady.
So John, what we can do for this one, if you just want to introduce, you've got Kieran up on the screen for you, so if you want to have a little interaction with Kieran at the beginning, quick little introduce the session, and then once you're ready and hand over, we'll cut into PowerPoint and 4 speakers. Yep, so standing by and live in 5, 4, 3, 2, 1.
Hi, John. Great. Thank you very much for the invite. Delighted to be here.
Perfect. It's a pleasure. Are you happy for me to hand over to you and to discuss your colleagues who will be joining us and about everything that's going on next?
Yeah, fantastic. Let me know when you want me to take over.
Yes, lovely. I'm ready when you are.
Okay, great. Thank you very much. Kieran Walsh is my name. I'm Clinical Director at BMJ, and I'm going to give a short case-based presentation on BMJ best practice, and hopefully we'll have a short panel discussion at the end with my colleagues, Doctors Amal Mayer, Eva Brady, and Angelika Sharma. So to dive into the subject of BMJ best practice, improving clinical decision making. First of all, a few slides about evidence-based medicine, because clinical decision support should be about the implementation of evidence-based medicine. Gordon Guyatt first coined the phrase evidence-based medicine in 1992, and he talked about the need for a shift from intuition, unsystematic clinical experience and pathophysiological rationale to scientific, clinically relevant research. And the definition has gone through iterations down through the years, but we like this graphical definition that says evidence-based medicine should be about the best available research, resources, including practitioner and professional expertise, and population characteristics, needs, values, and preferences. And yet there are challenges to doing this and challenges to the implementation of evidence-based medicine. First of all, there's information overload. 150,000 articles published per month in medicine and healthcare. The amount of medical information doubling every 5 years. And at the same time, the slow pace of change. It takes years for new clinical knowledge or new innovations to become routine clinical practice. There are multiple examples. Just one is thrombolysis and myocardial infarction. And yet there's even more problems, and there's a long list of them here from a paper by Trish Greenhaw, Evidence-Based Medicine and Movement in Crisis. I won't read them all out. They ranged from the quality mark of evidence-based medicine being misappropriated by vested interests, through to lack of shared decision-making, and lastly, lack of resources for patients with multimorbidity, which we all know is so common. So what's the answer to all these problems? We think that the answer is not learning knowledge, because quite simply no advice on diagnosis, investigations, management, and follow-up. Now, and very importantly, I should say, it's freely available in England, Scotland, and Wales within the UK. Now, it's a knowledge resource and also a clinical tool. So rather than showing multiple features, we thought, let's walk through a clinical case scenario to bring it to life, and importantly, to look at it from the patient's perspective, which is often the missing link in evidence-based medicine. So here it is. Here's the scenario. Imagine we have a 70-year-old woman, here, COVID-19. And I just want to make one point about this, which is the volume of content and guidance that you have to be across today. When I was a junior doctor years ago now, you could still learn off treatments for common conditions. It's really not possible anymore. And just picking on one of them, the interleukin-6 receptor blockers, when they're indicated, there's a massive amount of knowledge you need to know about them, a great deal of detail required. But even commonly prescribed drugs like steroids, there's a great deal of detail needed about them. What type of steroid should you use? What exact drug should you use? under what circumstances. And that's part of the reason why we make more and more use of infographics in trying to portray this complex information. We also need to know the dose, and therefore we need links to relevant drug formularies like the BNF, the British National Formulary, also the BNFC for children. And what if you're the patient were to develop long COVID? Well, then you need to know a massive amount about the drug and non-drug options for treatment